It's Friday. We normally have a Health Friday conversation. Today we are having a conversation about eye problems, understanding the causes of eye problems and knowing when to seek help. Professor Dunera Ilako is an ophthalmic surgeon and incumbent CEO at Eagle Eye Laser Center. She's here. Dr. Kahaki Kimani is a senior lecturer, Department of Ophthalmology at the University of Nairobi. City, why are you laughing? So you say it, ophthalmologist.
Ophthalmology.
Eh?
I have my challenges. Ophthalmology isn't one of them.
Allah.
Yes.
Opto?
You think of that sea creature called an octopus.
The ophthalmology. Surely. Dr. Kahaki Kimani, good morning.
Good morning.
Welcome to Kenya's biggest conversation.
Thank you.
Karibu sana. Dr. Ilako as well. Karibu sana. You are a surgeon of what?
Ophthalmic surgeon.
Ophthalmic.
Yes. Our sister Ednah had written something else.
Put two
Ophthalmamic.
Mamamic.
Well, that was her understanding of it.
Karibuni sana. CT is an ophthalmic surgeon for proverbs. And he has the day's proverb.
I do.
Not from Papua New Guinea, where his headgear comes from.
Well,
even the shirt, actually. Is there.
Yes, even the shirt.
Papua New, maybe remove the jacket, but we need to see this.
Tuzuia.
Tuzuia raha. Toa kwanza, my friend. Our guests must see what you get from your country of Papua New Guinea.
Who knows exactly why it has come from Papua New Guinea. She knows the details.
Yeah? She has the details.
Insider information.
She has leakage.
The professor has leakage.
That's why you put on this shirt today.
But of course.
All right.
Yes.
You'll tell us the story. Now, for those of us who don't know the story, please tell us the story. The shirt?
The shirt is also from Papua New Guinea. I have a sister who is married in Papua New Guinea. She's called Professor Florence Muga Webster. Yes. She and the good professor here shared certain classes when they were in medical school.
Right.
Yes. Now, while they were sharing those difficult courses, I was studying education, something simple and easy on the mind. Yes.
Not those difficult to
Nay, surely. Cadavers, what? No. Just education theory and simple things that are good for the mind.
Very good.
Yes.
The proverb.
Our proverb for the whole of this week have been from the country of Chad. And this is our final proverb. Where two rivers meet, the waters are never calm.
Where two rivers meet, the waters are never calm. I want to start with you, Dr. Kimani. What's your interpretation of this proverb? You see, Dr. Ida, who may have some leakage. These two words you've had. Dr. Ilako may have. So, what's your interpretation?
I think it is when you have different ideologies coming together. It may initially not be calm, but somehow the two ideologies must find a common ground.
Initially there'll be noise, but the river will now become one.
Yes.
And flow. That's a good one, Dr. Ilako. What's yours?
I think it's more or less the same thing. And also, if you really don't come to an agreement, it's almost like when two elephants fight, the grass is the one that suffers. So you really have to come to a common ground.
Okay. Teacher, how have they fared?
Well, this is one of those examinations where you have no option but to pass. Because we're asking your opinion, and we're not going to differ with your opinion. So if we say it was, the range was 1 to 10, you both get 10. Where 10
you.
means you've gotten everything right.
Right. Right. Okay. Dr. Kimani, what do you teach at UN?
I teach ophthalmology. That is the specialty field in medicine that deals with the eyes. So I teach all things to do with eyes. But I also practice as an ophthalmologist. And so I also treat various eye problems.
Yeah.
What, Eric?
No, nothing.
And I'm smiling because when she says she does everything to do with the eyes, I'm thinking, you do. That's good. So when they say the eye is the window to the soul, it means you
Here
can
we
see
go.
the soul.
That is very true. Yes, the eyes are the window to the soul and
Yes.
to the body as well.
Mm-hmm.
Yes,
So you can actually see the soul.
yes.
Why?
From the expressions in
Why?
the eyes, you can tell what is going on in the soul.
Right.
Yeah.
The people talk about various eye problems in this country. Now, of course, I don't even want to ask you to start listing them because you will spend some time here just breaking down one small thing into various eye ailments. But what are the most common eye problems in Kenya?
So the commonest eye problems in Kenya, number one is a problem we call allergy. In any eye clinic, that will be the commonest problem we'll present with.
Mm-hmm.
And the other problem is what we call refractive errors. That is the inability to focus well when looking at an object.
Mm-hmm.
So those are the two main ones. And then, of course, we have other problems like cataract that impacts negatively on the vision. We have problems like glaucoma when you have high pressures in the eye. We have other problems associated with other diseases in the body like diabetes, which can affect the eye. So those are just some of the few top ones.
Would you say that the most common eye problems in the country are treatable and manageable? Because you mentioned allergy, so I think, okay, quickly you can do something for an allergy. Then you mentioned refractive, so then you can use sight assistance. What would you say that they're manageable?
Yes, in fact, most of the problems in the eye that can lead to loss of vision, about 70% of them, they can be treated or avoided. So you're right. Most of them are treatable or avoidable. Yes.
Okay. I'm looking at a situation where, as time goes, I'm looking at, here in this room, we're wearing glasses, but everybody will say the reason why you're wearing glasses is because you cannot see properly. But it could be different. The reason why you're wearing glasses could be different.
Yes.
And then folks will say, okay, well, over time, we've seen more people having to wear sight assistance in terms of glasses or contact lenses or whatever.
Yeah.
Have we seen that there's a progression of some of these refractive issues over time? Has sight regressed in terms of its quality? And are there factors that contribute to this, or is it just how you're made?
That's a very interesting question you ask, and for sure, over time, it has been noted that some of the eye problems have increased in magnitude, and especially like things to do with short-sightedness. It has been shown to be increasing over time, and probably it is because children spend a lot of their time indoors looking at screens, looking at phones, and that can contribute. That has been one of the reasons that has, or one of the theories that has been brought forth as to why problems like short-sightedness are increasing. But also with people demanding better vision because of the nature of maybe the jobs they do, then they cannot tolerate any minimal decrease in vision. And so they will come earlier to the clinic or to hospitals if they have eye problems that are interfering with their vision. But also as we age, as we grow older, and we are blessed with more years on this earth, then there is the tendency to have more eye problems. And especially like as we get to beyond 40, then you find reading small print starts becoming a challenge. And that's why now many people will start wearing glasses even though they were not wearing glasses before. Yeah.
Prof, at Eagle Eye Laser Center, now when you hear laser, and this is an ophthalmic surgeon, you just see where this conversation is heading. So what is it that you do at the Eagle Eye Laser Center?
First of all, when you say ophthalmic surgeon, I mean the field of ophthalmology is one of those really, really special fields because it's both medical and surgical. And at Eagle Eye, we are also there. I'm also at the university, but slowly on my way out. And so we work with Dr. Kimani. We treat everything eyes. But what is also special about us at Eagle Eye Laser Center is that we have, I can see you're all wearing glasses here, and many of you would not want to wear glasses. You want to show your beautiful and handsome faces. And therefore, one of the things that we actually do is assist you if you're suitable, and depending on so many factors, we can get rid of your glasses. And getting rid of the glasses is not only cosmetic. There's some diseases that many people have to wear, let's say contact lenses, and they are not cannot tolerate contact lenses. So we are really a refractive center, helping you get your maximum refraction, as she has discussed, good vision, using laser procedures.
Laser procedures, getting rid of my eyeglasses so that my eyes can be seen with greater clarity. Okay.
So that you can see with greater clarity.
As he's building up to this, we've had a conversation with CT before where he's questioned this thing of, look, surgery is surgery. Now you are going to start tinkering with my eye in there using laser. What long-lasting effect is it going to have on me?
What if you tinker? Because I start from the point of surgeries. Most surgeries, a vast majority of surgeries done on the human body are successful. But every once in a while, you hear a horror story. Some spanner was left in someone's belly. Okay?
True.
Well, the spanners they use for operating and so forth, that's what I meant. Okay? Now I'm thinking, that's my stomach, you can remove it. Stomach, large surface area, very many things moving in and about there, most of them stationary. My eyes. Someone coughs. What are you likely to nick in the process of lasering my eye? And when you nick it, what then happens to my vision?
Prof.
Like you say, surgery, or laser, I don't know whether to call it surgery or a procedure, or because when you start saying surgery, you get reactions like this, that I'm going to get a spanner left in. With laser, it's relatively safe, almost 90% safe, only because the instruments that we use, whatever we do and whatever procedures that we do, there's gadgets that are there that we actually use, the laser machines. And if anything is going to go wrong, it will stop. If anything, they feel that it's not focusing or they feel the numbers are wrong, just tells you, it's like, the AI just tells you, no, do not continue. So that gives us a bit of courage to continue and not to continue. And also, like any other procedures, definitely the first thing you come when we're discussing and talking to you, much as 90% or 99% safe, the first thing we'll tell you, the worst thing, you'll go blind.
Well,
and then we come from there and tell you why you will not go blind. But we cannot, you've opened your eyes so loud.
I'm like, what? Okay.
No, we actually talk you through the whole thing and explain to you why it's good for you, what is good for you, what can happen, what complications can happen.
You see why I raise these issues, is I wear glasses, and every so often I go to my ophthalmologist or optician, and they do this test to determine whether the strength of my glasses need tweaking or whether they are. But what essentially they're telling me is that my eye is either maintaining a certain constant or it has deteriorated. Very rarely have they told me my eye has gotten better. Okay? So now I am thinking, if a laser surgery is performed, what if my eye does the thing it used to do before? Does the laser surgery prevent deterioration? And in the event that it requires a little correction, so more laser?
Actually, you ask a very important question. And one of the things, so before we decide whether you are suitable for laser or not, there are several tests that we do. And also, we will take history from you on how long has it been since you had to change your glasses because you couldn't see well. Many times, actually, for most people, once you get to be an adult, the eyes change very little. And often the reason why you need to change your glasses is either you want a new look, or maybe the lenses you have are a bit scratchy, but it will not have changed by much. And so you'll notice probably the clarity you get from your new glasses is more because the lens is now clearer rather than the number has changed. And so one of the things we have to ensure before we even consider doing laser surgery for somebody is that your eyes are stable. They are not changing any further. But you remember, as I said, as you get to your mid-40s, late 40s, the issues of focusing near objects comes in. And that will not change. Even after we do the laser, when you get to that age, you may still probably need reading glasses.
You know, I have to ask this question. What is it about age and nearsightedness and farsightedness? How does age come into this equation? And yet you say the eye doesn't change much. So I am assuming as I get older, it doesn't change much. And yet then it has changed.
Yes.
I speak as a long-sighted person.
Yes, you're very right. Yes. But for the distance vision, it tends to remain stable. So when I say stable, it is in reference to being able to see far. But when it comes to being able to see near, you see, like for young children, they can really change their eye a lot to focus something that is very near, and then it changes to focus something that is far. And as you grow older, that ability to change that focus decreases, and it reaches a point where the ability is so small that you cannot look far and then come back and read at the same time. You need additional help. Yeah.
And is that because of wear and tear? Is that what we're talking about? What physiological changes are happening in your body that then say, does the quality of sight then deteriorate because of changes, wear and tear as you get older? Is that what happens?
Yes. You see, the lens, there's a lens, if you remember, he's an educationist, so he knows about biology, and there's the lens in the eye. So the lens in the eye is the one that grows throughout life. And then the lens stiffens and hardens. And it's the one that's not able to change its structure in order for you to focus. Unlike in the young, the lens is able to just relax and contract at will. So it's the lens in your eye. You understand that, Mwalimu?
I get that. Yes, so essentially what you're saying is we need to find a way of slowing down or eliminating the aging process.
Yeah, but even now, there's certain, it's not all lost, especially like we said, our center is mainly refractive. So even if your lens in your eye, as you get to cataract age, These days, before you still used to replace the lens in your eye and still wear reading glasses.
Right.
These days, there's special lenses that can now make you act like now, be able to focus far and near at the same time.
Your
Make you a
bifocals and your
teenager.
trifocals kind of thing.
Yes, that thing is, you can also now do it for the eye itself. Yes.
Oh, that's so groovy.
Yeah.
So, are refractive issues, can you be born with refractive issues? I ask this because usually you'll see, because I've been wearing glasses since I was 7. And now maybe my vision had been compromised from birth, really didn't know.
Were you born at 7?
I started wearing glasses at 7.
Okay.
So I remember even being younger that I couldn't really see and I would squint a lot. And so that was what was for my folks and even my teachers at school would say, okay, well, bring her to the front of the class kind of thing so she could see the board. And then when we went for tests, when they said, okay, maybe the problem here, it's been there for some time. This didn't develop as you grow older. So are refractive issues, can you be born with them or do they come about with environmental factors influencing your vision, even at that young age? Or is it a case-by-case issue?
Okay. One of the commonest refractive problems is short-sightedness.
Yeah.
Like you are, I'm
Severe
sure if
myopia, yeah.
took away your glasses, you can't even get home.
Well, you get a seeing eye dog. Okay.
So people are born with that. They are already predisposed to short-sightedness. But for most people, it starts showing up in the teenage years. That is when they'll start noticing, oh, I cannot see very well what is going on in front. But there are also some cases where children are born with short-sightedness.
Okay.
Not often, but that can happen. And for such children, as they grow, the short-sightedness becomes more and more. And for quite a number of people, they will not be the only ones who are short-sighted in the family. So there is a genetic component. Yes, there is a familial component when it comes especially to short-sightedness. But there are also other problems of focusing, like long-sightedness.
Yes.
So you can have children also who are long-sighted, who they can fire, it's not a problem, but when it comes to reading, they have challenges, they get headaches, and they will need glasses for that. But the beauty with that, as they grow older, it tends to get better. So unlike short-sightedness, which becomes worse as the children grow, long-sightedness tends to get better. And eventually some of them may not even need glasses anymore. Then there is also this problem that is always a bit difficult to explain or to describe. We call it astigmatism.
Yeah.
Where it means that the curvature of your eye is not even. And so they are like, if you look at a straight line, it will tend to look a bit warped or crooked. And for that, it can be corrected with glasses. And usually it may get worse or better over time. But by and large, most eye problems do not get better. Most of them get worse unless addressed. And that's why, especially for children, it's very important to pick out these problems early enough so that their learning is not compromised. Because there are many children, probably they are considered dada heads, and it's just that they don't see well in class. You give them a pair of glasses and they become as good as everybody else.
Let's take a break. It's a Health Friday conversation. Today we are talking about eyes and when to know when to seek treatment. That's what we'll be discussing shortly. Dr. Kahaki Kimani is a senior lecturer, Department of Ophthalmology at the University of Nairobi, and Professor Dunera Ilako is also a lecturer of ophthalmology, as well as being an ophthalmic surgeon and CEO of the Eagle Eye Laser Center. Dr. How many ophthalmologists do we have in the country? And I'm asking this because of the next question, which is, when people have challenges with eyes across the country, how easy is it for them to get help?
Unfortunately, we do not have the number of ophthalmologists that we would desire as a country, because currently I think probably we have about 150 ophthalmologists
Wow.
across the country, and that 150, it's even made more insufficient because most of them are in the cities. Yeah, probably like 60-70% of those 150 are in the cities, which leaves the rural areas very underserved. And so we still have a gap there. But fortunately, there are other cadres in the field of eye care that can still take care of basic eye problems. You have the clinical ophthalmic officers, you have the ophthalmic nurses, you have the optometrists, the opticians, and those ones help to fill the gap. Yeah, but still, access to eye care is not as good as we'd want it to be as a country. But suffice to say, if there is a need, then somehow that need can still be met with what is currently available. Yeah.
So when somebody has an eye problem, let's even talk about children. So a parent notices that a child may be having an issue with vision. They will go to the nearest health facility to them. Now, are the people that they're going to find there sufficiently equipped to be able to, one, just decipher what's happening and know the protocols to deploy, whether it's referral and all?
That's a very important question, because actually as a country, the backbone of our healthcare is in what we call the primary healthcare, the grassroots care that a mother will find when she takes her baby to the clinic. And a lot of effort has been made to include primary eye care into primary health care, although this has still not worked as good as it should. In fact, like when a baby is being taken for immunization, in that booklet, there is a page that explains to the nurse who is immunizing the child what they should look out for. And there are two big things that one should look out for in a baby. Number one is the pupil black, the center of the eye. There is what we call the pupil, and it's supposed to be black. If that pupil is not black, there is a problem. And especially if you see the pupil is white, it could either mean that the child has a cataract, because babies can also be born with cataract, or it could even be a bigger problem like an eye cancer.
Sorry, just clarify, because there might be folks out here who are not getting. So there's your eye where you see the eye color.
Yes.
But then there's the little black dot in there.
In the center.
That's what we're saying is the pupil.
That
Exactly.
needs to be black.
That needs to be black.
Yes, that
All right.
needs to be black.
Okay.
And if it's not black, there is a problem.
Okay.
Number two, are the two eyes looking straight? If the two eyes are not looking straight and one eye is either looking outwards or inwards, there is a problem. And if those two problems can be picked out early in a baby, then a lot can be done to save the vision of the baby and even to save the life of the baby. Then as the children grow older, as they start going to school, one of the things that the teacher should always look out for is the child struggling either to see the blackboard or to write on the book or to read. If such a problem is noticed and picked early, then it can be addressed.
What would be a problem of discoloration of the pupil? What would that indicate?
When the pupil is not black.
Yes.
Number one, as I said, one of the biggest concerns that we have is that it could be cancer. Okay? And that is a cancer that can be treated and save the life of the child if it's picked early. and sometimes even save the eye of the child. Number two, it could also be a cataract, when the lens in the eye, instead of being clear, it becomes cloudy or white. And that can also be addressed by surgery and restore vision in the eye of such a child. You see, for children, time is of essence, because when babies are born, the centers for vision are not fully developed, and they need stimulation through vision to develop. If this stimulation is interfered with, then later on in life, even if the problem was addressed, that suppression that occurred in the brain cannot be reversed. And so you end up with an eye that looks normal, but it can't see, because it had a problem that was not addressed in childhood. Yeah.
So are the health professionals at that grassroots level then being trained on these things? Because you've said, we want to get to a level where we are using primary healthcare and primary eye care going in tandem.
Yes.
That would mean, because clearly we're not going to have all these ophthalmologists at the grassroots level, that the primary healthcare person is well equipped with the knowledge to detect this.
Okay, in the training curriculum of most of the primary healthcare workers, primary eye care is included, but it just touches. It doesn't go into detail. And so probably what is required is refresher courses, constant refresher courses, to keep reminding these primary healthcare workers on what to look out for, and not just in children, but even in
across all ages,
including the elderly, where the eye problems are more. You find that eye problems that affect vision are much more common in older people than in the younger people.
One hears of specializations in the healthcare space. One knows of doctors and their specialization, the disciplines they belong to. But the other, I wouldn't call it supporting, but other professionals, the nurses, the clinical officers, and we hear of specializations. Even within them, like you hear an ICU nurse, that's a specialization. A dental, something or the other. In ophthalmology, do you have such specializations within these other cadres of the health profession?
Maybe Professor will answer that.
Yes, to a certain extent right now what they do, especially the ophthalmic clinical officers. So the ophthalmic clinical officers are first and foremost clinical officers. Then they come back and train as eye specialists. Now within that eye specialist, some of them become cataract surgeons. So they specialize just as cataract surgeons. Some of them become low vision specialists. And their last one is probably, what's the other one that they do? No, I think those are the main things. Cataract surgeon, general ophthalmic clinical officers, then cataract surgeons, and then low vision therapists, and then maybe refractive surgeons. But that's the main thing that they do.
But among the cadres of the nursing,
no.
Health specialists, no.
No, those ones are just general. They're general ophthalmic nurses.
Should it not be more specialized? Because you get nurses in larger numbers. When you look at the various levels of healthcare services that we provide, then we do clinical officers and medical doctors.
No, I think the basic things really, because you also want to fill this gap that is there, you need ophthalmic nurses that know how to diagnose and refer. It's very difficult for you to have people to be all cataract surgeons, because the equipment that's involved, the specialization that's involved, the training that's involved is pretty expensive. So you need people that are able to really pick up early diagnosis of most of these things, and if they're referred appropriately, then that would be fine. Already in the eye, we have so many generalized, not general ophthalmologists, even special ophthalmologists. You have pediatric ophthalmologists, retina specialists, cornea specialists. Then again, when you over subspecialize, then the general majority of the Kenyans still suffer.
Okay.
So you really need that.
If you move these cases up the ladder, at what level of hospital categorizations will you find an ophthalmologist? Or are you supposed to, in theory? Because the reality may be different.
In theory, every sub-county should have an ophthalmologist, in theory. You need one ophthalmologist per 250,000 population. We are only 150 or so for 50 million. How many is that?
And we need one for every 250.
Yes.
What do we have currently?
Now you calculate. We told you we are 150.
We're only 150.
We are 150, and then out of that 150 of the 50 million, out of these 70 of us are in Nairobi and Mombasa.
So it's wholly inadequate.
Very.
You see where I'm going with this? I'm looking at, you talked about primary health care. Essentially, that's where the preventative stuff takes place. And that's where you're able to prevent all these things. More so in children, if you can identify the problems early.
Yes.
Now, sometimes you can't escalate to a level 5 or 6 hospital or even level 4. Now, where it can be managed, where it can be diagnosed, and where it can be managed is at that village level. Okay? And this is why you see me focusing on the depth and the length of training that these individuals go to. But then there's this connectivity between, one, the health facilities and the school. I will always go back to the school. Because this is where now children begin to interact with each other and they're together in larger numbers. Do you have, because I know you have an association of eye specialists, eye people like yourselves, do you have a program or a plan where you work with schools and learning institutions so that focus specifically primary, nursery school level, people get whatever it is, sensitization talk, so that some of these things, when these issues we're discussing, which can follow on into adulthood, with adulthood type problems, are identified early and addressed?
That is a very critical issue that you raise. And we used to have what used to be known as school screening programs, where like an eye team based in a certain area, they would cover the schools within that area or within that zone. So they would go to the school and even train the teachers to just look out for children who have vision problems, just by asking them to read a chart from a certain distance, and any child who can't read up to this level, then that child will be referred to the eye center for further assessment to see do they need glasses. But this also required funding. You need transport to go to these places, and probably many years ago, unfortunately, the eye care program had been left to the non-governmental organizations. And then we realized it's very important that government also takes responsibility. This should be truly their work. And so over time, a lot of the non-governmental organizations have veered off from this basic eye care. And there is that gap now. So the school screening programs are not running as well as probably they used to run in the past. But this would be a very critical way of meeting this gap.
Okay.
Yeah.
What advocacy work does your association do to ensure that you corral, push, intimidate the government into understanding and carrying out this role?
I think we're doing a lot. It may not show we're small, the eyes are small, but in terms through the society and through our head of in the government, who is a very keen person and also a good, he really contributes. Every time we have any problems, like right now, we've been having problems with eye drops that make children blind. I won't go into the details, but he's taken that up as a society and really tried to push that some of these things go forward. So in that society, we always have weekly, monthly CMEs, bring up our issues and our problems, and then they escalated forward. Slow but sure. It's very, very difficult, but slowly we hope we'll get somewhere. We've just tried to strengthen that society.
And also maybe just to add on, you see, as eye care, we are competing with things like malaria, maternal child health programs, maternal mortality, and
non-communicables.
Yes, yeah. So we as a society, we really try to advocate and push the agenda for eye care, so that even as resources are being allocated, we are not left out. We may be allocated meager resources, but at least we will try and do the best we can with those resources.
You're a true Kenyan.
Understanding the situation.
Understand the situation.
And working and conforming.
And perhaps kicking the can down the road a little bit. and ring fencing also at the same time. And it's good.
Sorry, there's just one eye disease that probably we should also talk about briefly. Remember, we said one of the commonest causes of eye issues is allergy.
Yes.
And with allergy comes problems. People really rub the eyes so much. So when you rub the eyes, the cornea gets affected. Okay? And when the cornea gets affected, you get a certain disease called keratoconus. So now some of these individuals start to experience reduced vision around the age of 14 and really gets worse towards maybe 19 thereabouts. So these are the people that we need to also catch early, because before, the only option after the cornea is the clear part, the glass of the eye. The only option was for them to have a corneal graft or corneal transplant.
Wow.
So these days, at least, it's been brought around in Kenya. There's certain procedures that you do to stop that growth. And that's something that people must be aware of, because it's quite a big problem in our country.
Don't rub your
now.
eyes.
A very big problem,
Do not rub your eyes.
Yeah, can you tell your child, do not rub your eye and it's itching? Or even you, if I tell you,
it's hard. It's a difficult thing.
It's hard. It's hard, but it's possible.
We've got to do it. Dr. Ari, thank you very much for joining us. Professor Dunera Ilako is an ophthalmic surgeon and incumbent CEO at Eagle Eye Laser Center, and Dr. Kahaki Kimani, senior lecturer at the Department of Ophthalmology at the University of Nairobi. Thank you very much, ladies, for joining us and for sharing all the knowledge with us.
This is the Situation Room, the only way to start your day.